Good morning, friends. Dr. Devasy from Ayushvaidya again. I received a patient the other day with a very sharp stabbing kind of a pain, especially when walking in the morning. The first step is very, very difficult. Pain worsens with exercise or long standing. There is swelling and tenderness, difficulty in walking barefoot, and so on and so forth. So why heel pain happens? There are 5 or 6 reasons why heel pain happens. Number one is basically, it could be, we call it as the calcaneal spur. There could be bony growth in the calcaneum or the heel bone. There could be bursitis. That means there is a cushioning pad which is there in the heel. It gets inflamed. It could be the wrong footwear, what you wear. High heels, or the footwear could be malaligned footwear. The soles could be, disbalanced. So those things can cause problems. Systemic conditions, just like arthritis, you have diabetes, it could be nerve compression. And a very, very common thing that I generally find is plantar fasciitis. So it happens with the inflammation of the thick tissues of the plantar fascia. So if, on our sole, there is a fascia which actually get overstretched, or once it gets overstretched, and of course there will be some swelling and all those things. How you take care of it is, what allopathy does, they will be giving some painkillers, could be physiotherapy, could be steroids and things like that. There is also very good shockwave therapy which is there. And if the condition worsens, of course surgery is done. But in Ayurveda, how we take care is basically through, a series of treatments. We give Abhyanga or the foot massage, and it really helps. The second is, of course, we can give some Kizhi, or we give herbal bundle massage. We heat the, it could be churnam or any powder, it could be leaf. So we actually heat that particular thing in a little bit of oil, and then we give, sedation, or we give massages on that. Internal medications, yes, there are some internal medications, just like Gugulu is there is Shallaki. There are some, strengthening or anti-inflammatory medications, even curcumin, all those things we try. So along with that, definitely you require physiotherapy. That is very, very important. You have to give mild to moderate level of exercises, correct your footwear, and take good care of your feet. And especially I'm giving a word of caution for people who are diabetics. Please do take care of your leg. It is very, very important. They have a tendency to have, regular injury without even knowing, because of neuropathy, peripheral neuropathy, and the wound will take a lot of time to heal. So with that, I leave it to you, and we will meet next time with new information. Thank you so much. God bless you all.